Hi everyone, my name is Megan Tarvis, and I am currently in the Women's Health Nurse Practitioner track at Regis College. My nursing background began on a med surg floor, working for the first 2 years of my career. I worked with patients, post-op patients, ortho, urology, and colorectal. A lot of pain management on that floor. So dealing with a lot of narcotic use as well as antibiotics. My sparked interest in women's health when I transitioned over to my current job, where I've been at for a few years now. I work in the women's health emergency room at a all women's hospital. We see OBGYN emergencies, we see laboring patients, prenatal complications, as well as oncology, and a new range of population we're experiencing is any med surg patient that is a woman can come to the hospital now, like possible appendicitis, GI complications, as well as like any or chest pain, shortness of breath. This is a new field for our emergency room, but I am excited to experience a little bit of med surg patients again. Experience with pharmacology. Well, we are all nurses, so we all distribute medications to patients. I think education is most of our experience as well with medications. Sometimes it's difficult to educate a patient on what the medication specifically does and what it's used for, but we try our best to make sure that they understand why they're taking this medication and why is it's important for them. An example would be we give betamethasone for preterm labor to help babies' lungs mature more. So we have to educate that to our patients when they're receiving the betamethasone shot. They feel more confident and trustworthy with their providers as well as nurses when you educate patients more on what they're receiving and why. Also, when they're being discharged, make sure they're taking their medication appropriately, things to avoid, as well as the reason why they're taking it and why they shouldn't stop taking it, like an antibiotic. Another thing that's a popular trend in my hospital is group beta strep. When a woman is positive for group beta strep, usually we have to give them penicillin. As you know, many people have penicillin allergies when they're younger, and like a rash, for example. We often have to communicate with pharmacy to make sure and fill out a criteria to make sure they can be treated with penicillin if they are group beta strep positive, versus like a patient that was anaphylaxis 5 years ago. We would obviously not give that to them. So sometimes that's difficult to communicate with the provider and the pharmacist to make sure the patient's receiving penicillin or not. I chose this concentration for a women's health nurse practitioner program because I became interested. I was a little interested when I transitioned over from med surg, but then my interest grew as I began to work in this department. I enjoy the women's population, and treating them and educating them. And you can tell the patients definitely appreciate the relationship with the providers and healthcare workers with belonging to a patient-specific hospital for women's. I think they would rather go to that hospital versus any other hospital in the state because they feel like they're being heard and listened to. So it's nice to give them the care they deserve. Women's health requires specific care for certain things, and it's definitely a vulnerable topic for some patients. So it's nice to be able to want to help these patients one day as a provider. After reading the chapter on prescriptive authority and researching in my state, the state of Rhode Island does not have any limitations to practice or prescriptive authority. I also looked at the narcotic use because some states don't allow providers to prescribe certain narcotics, but there's no limitation as well, which is good. So nurse practitioners can prescribe, diagnose, and dispense within the state of Rhode Island, which is good to and interesting to look up different states, how some have full restrictions versus some have limitations, as well as some who are fully not restricted, like the state of Rhode Island. I look forward to listening to everyone's presentation and getting to know everyone, and have a great semester.